In most aspects of our lives, no matter what our age, we all have a bar to meet and rise above. So it makes sense that our entire country as a whole would have one to meet as well. Poverty, crime, education, housing, medical care. These are all factors to consider when it comes to the quality of life. So how do we rank as a country? Let's break that down even farther yet. How do we rank as counties here on Delmarva? Well, joining us now to tell us are Abby Cofskey of the Robert Wood Johnson Foundation and Julie Willems-Van Dijk of the University of Wisconsin School of Medicine and Public Health. Ladies, thank you so much for joining us today.
Our pleasure.
So let me ask you this. This study has been done for 6 years now. Why do you think it's so important?
Well, the county health rankings are an annual snapshot of overall health and well-being, as you put it. And these rankings give us a sense of where we're doing well when it comes to creating opportunities for health, but it comes also as an opportunity to point to where we could be doing better. And to be able to do that at a county level is really an opportunity to engage our local leaders, school leaders, business leaders, elected officials in the type of change we know is necessary to create an environment where everyone has the opportunity to be healthy.
Okay, here's the part where we get a little bit nervous. How do we here on Delmarva do overall?
Well, we know you have counties within a number of different states in your region, and so one of the things we do want to emphasize is that it's really important to compare the rankings of counties within states. So as we look at the two counties in Delaware, Sussex County ranks first in Delaware, while Kent County ranks third of the three counties in Delaware. As we move to Maryland,
so in Maryland, what we'll see is Queen Anne's is ranked 6 of the 24 counties that we rank in Maryland. Talbot coming in at number 7, Worcester at number 11, Wicomico at number 17, Dorchester at 19, Somerset at 20, Caroline at 23 of the 24 counties. So again, you see a range there. And then in Virginia, which we know folks are close by, Accomack County comes in at 110 of the 133 counties.
Okay, so of what you've seen, where have we made the most improvement? What areas do we still need to work on?
well, what we're seeing across the nation is that we're seeing encouraging trends in terms of premature death decreasing. That means people are living longer lives. And what we know is that in order to do that, we need to look at those underlying factors that Abby was referencing earlier. So we know in many counties, in almost every county throughout the nation, obesity is an issue. So looking at how can we improve access to healthy foods in our schools and workplace and at home. How can we help people be more active? But also, how can we look at how they can have better paying jobs so they can afford that healthy food and that bicycle? And so how do we help children succeed in school? How do we make sure our youngest children are getting quality preschool? Right. And then how do we work with business and government to make sure there's good paying jobs in our communities?
Did you happen to see anything that surprised you?
I think one of the things that surprises a lot of folks in looking at the county health rankings and continues to surprise us is that, we often think that the solutions for better health are going to happen in our doctor's office. And the county health ranking shows us that no, in fact, we need to be looking at other sectors. So one of the things that we look at in the county health rankings is access to quality housing. And it's always surprising to see how many households are living in housing, in homes that don't have adequate facilities, families that don't have enough money to make ends meet when it comes to paying the rent. And I think for a lot of us that is surprising when we think, how does that contribute to health? But in reality, it contributes a great deal. Whether it's poor housing contributing to increasing rates of asthma, whether it's because people are spending more money on rent than they are healthy foods. So I think that's surprising for us and surprising for many folks when we think about what is it going to take to move the needle on health.
All right. Abby, Julie, thank you so much. Some incredible information that is extremely important for our community leaders to be able to make some changes in our overall health. Thank you so much for your time with us this afternoon. Now, if you would like to learn more about the study and the county-by-county rankings on our overall health, all you have to do is visit WVOC.com and click on our picture at the top of the page. A large part of our health is determined by our oral health, but a lot of people shy away from the dentist simply out of fear. After the break, we're going to learn about sedation dentistry, how this practice may have you flashing those pearly whites more often. And it's not just we humans who need dental exams. Our dogs and cats are at risk as well. So later on, we're going to find out how important it is to get our pets' teeth cleaned professionally. In fact, it might be life-saving. But first, you know Delmarva Life's all about our community, and that includes your community too. Is there something going on in your neighborhood? We would love to see about it. We'd love to hear about it. Send us your photos. Tell us all about the event. You can send it with any pictures that you'd like to share to comments@delmarvalife.com, or you can just like us on Facebook and share the information there. Delmarva Life, we'll be right back.